Vaginal delivery introduction. Purpose and effect of procedure. Vaginal delivery is giving birth to a baby through the vagina, unlike cesarean section in which the delivery is done by incising the uterus through mother's abdomen. Vaginal delivery is also called normal delivery. Vaginal delivery is divided into 3 stages. The first stage is when labor pain starts, and the entrance of the uterus opens up completely. The second stage is when the fetus comes down, and delivery is done. The third stage is delivery of placenta. Among the 3 stages, the first stage takes the longest time. It takes about 10 to 12 hours for a premipara, and 4 to 6 hours for a multipara. When the cervix doesn't open easily, or when delivery is delayed because of weak uterus contraction, uterine stimulant Pitocin could be administered to induce delivery. The second stage, in which the uterus is open enough and the baby is born, takes 2 to 3 hours for a premipara and 1 to 2 hours for a multipara. Episiotomy could be performed to prevent mother's perineum from getting damaged by the fetal head. At the third stage, where expulsion of placenta occurs after baby's birth, the vagina is strongly contracted that blood with placenta and byproducts are released out of the vagina. On the other hand, C-section is operated if one who has the past history of the procedure. If fetal position is abnormally placed, such as breech or transverse presentation, placenta previa, or a case of twin pregnancy, a case of placental abruption, mother's pelvis is not acceptably widened compared to a fetus head, the delivery process is not going along normally, a failure of induction of labor, poor fetus condition in uterus, and when the rapid delivery is required for the mother and or the fetus. Preparation for delivery. When the delivery is impeding, there will be regular labor due to uterine contraction, and also vaginal discharge that blocked uterine cervix will be shown. In this case, please prepare to come to hospital, since the labor starts after a few hours or days of having the discharges. When a regular labor occurs, 5 to 10 minutes interval for a premipara, and 10 to 20 minutes interval for a multipara, please come to hospital. If there is a water and liquid flows, please come to hospital regardless of pain labor, and check whether the amniotic fluid breaks or not. Hospitalization is required as there is a symptom that shows delivery is in process, and monitored by using ultrasound and obstetric diagnosis. At this stage, preparations for delivery are performed such as fasting, enema, and central venous catheterization. The process of normal delivery. At the first stage is when labor pain starts, and the entrance of the vagina opens up. Medical team monitors the condition of fetus by cardiotachography, which records the fetal heartbeat and the uterine contractions. Epidural anesthesia is injected into the empty space of epidural of spine at the time of half-open cervix. The way of this, sensory nerves which feel the pain that are only anesthetized, and leave the motor nerves which help to keep staying motor control to push and giving a birth. It doesn't mean that epidural anesthesia makes the mother won't feeling anything, but it assists to relieve the pain for most of mothers. However, since it is only available when the delivery process is underway, it may be difficult if it is a bad timing or other issues occurs. When the fetus comes down with completely widened uterine cervix, mother is needed to lie down on the delivery bed. Also, the one is required to follow the protocol to build a strength for helping contraction of uterus. There are some options that the obstetrician takes for giving a birth. Vacuum delivery can be operated by attaching a specific vacuum on the fetal head, or forceps delivery also could be performed by using a tool which helps the delivery. Also, episiotomy may be performed to prevent mother's perineum from getting damaged by the fetal head at this stage. After fetal head is come out, stop pushing and deliver the baby's shoulder in the whole body with relaxing state. The nurse in charge of newborn checks baby's health after cutting the umbilical cord. After all the procedures are done, the uterus might be strongly contracted, and by doing this, blood with placenta and byproducts are ejected out of the vagina. Doctor sutures the episiotomy scar at this stage, and delivery is finally done.